herbal medicine is definitely a science, but there's a lot of art to it as
Oh,
well. And
absolutely.
we
Yeah.
have a lot of herbs to choose from, and it is, sometimes yes, you can use your energetics, you can use your phytochemistry to try and work out what's right. But sometimes you have to work, excuse the pun, on your gut feeling and
Yes.
choose the herb that you think is right for that particular
Yeah.
person. And some people, you can just see that there's some degree of they can see an overlap between them and some herb, and that sounds very wishy-washy, I know, but there is that association that comes to mind when you see them.
Yeah, I mean, the point I was going to follow through there is that, for those new in practice or students or whatever listening to this, thinking this is an appallingly difficult challenge, that if you're working with the gut, it will often be your best guide, and even if you don't have that magic first, luck with your first hunch, you can usually keep at it until something does begin to work. If you just keep at it.
Exactly. And I think, if you're in doubt where to start sometimes with gut issues, I always go in there with chamomile tea and a probiotic, because, you
Start
can
with the
you can
teas.
cure many a thing with a probiotic, a prebiotic, which
Yeah.
chamomile is a wonderful prebiotic in tea
Yeah.
form. And
I,
just,
I will sometimes invite would-be patients to start with teas even before they come in, so that they can give me some information.
yeah.
And they do, as to which seems to suit them better.
Absolutely.
Great.
And it is important to hear the feedback from patients as well, what they find, what they think's working for them.
Yeah.
The body, as we all know, has a lot of inner wisdom that we tend to try and ignore and filter out.
Yeah.
And getting patients to listen to and, repeat that wisdom to us, it tells us a lot about what's going on and what they may need. And I always
Sure.
think, with these complex conditions, it's a bit like peeling an onion.
Yes.
Often you go in, if your first prescriptions take off the first layer, then there's a very slightly different layer underneath. So you have to change things a little bit. Then there's another layer, another layer, another layer, until you get to the real heart of what's going on there. And that is what you need to work at, to get to that heart, to really change the underlying cause that's causing the disease. Because the disease is just a symptom, isn't it? It's
Yes.
realistically, we need to look about what the underlying cause is that's manifesting as a disease.